Analysis of implementation of the tobacco control policy in Kenya. Now, the objectives of the Tobacco Control Policy 2007 was to prevent non-smokers and people under the age of 18 from using tobacco and protect them from second-hand smoking, protect tobacco consumers from misguided incentives to use tobacco and alert them of the risks, research and disseminate information to the public on the harmful socio-economical, environmental and health effects of tobacco, eliminate illegal manufacturing, smuggling and the trade of tobacco, advocate for tobacco farmers by suggesting that they use other crops, and create quit tobacco programs and rehabilitation centers for tobacco consumers. Now, justification for analysis of implementation. Why did we do the analysis of implementation instead of doing others? I'll bring you the Australian policy cycle model, which we actually used, and we did policy analysis. We did the policy for analysis for policy and implementation, and these are the reasons why we did that. Now, policies aren't really effective if they aren't really implemented, and there's no way you can measure outcome or impact if the implementation phase doesn't really occur. The other thing we saw is that Kenya being a middle income country, we see that there's actually hardships in implementing the tobacco control policy, and so there's actually room there for improvement. Now, this is the analysis. Protection from second-hand tobacco, protection from second-hand smoking and tobacco use, prevention. Now, in the government areas and office buildings, which have actually been declared smoke-free zones, actually that seems to be enforced. However, you see that entertainment areas and hospitality places, they aren't really smoke-free zones. Even if the signage and smoking areas, really you can't find like a particular area where somebody can go and smoke. Now, the mass media campaigns, the research and information to the public, and of course also the training of enforcement officers have actually been done. However, it's really not sufficient because, as you can see, hospitality and entertainment areas aren't really complying with the rule. Promotion and advertising and sponsorship of tobacco by, of course, tobacco companies. Direct advertising and promotion, of course, and sponsorship, which we call TAPS, TAPS, has actually been banned, but you can see there's like indirect advertising and promotion that actually occurs, which is actually subtle. You can see there's a kiosk that's been painted by all these Supermatch tobacco. I mean, these are kind of cigarettes. That's actually a national celebration there, as you can see many people, and you can see British American tobacco there. They're actually matching with their flag, so that's not really good. Now, labeling and packaging of tobacco products. The health warnings on tobacco packaging is only in text, really. There is no pictorial health warnings like the one we see here in Australia, and there's actually no system for monitoring tobacco industry activities, really, and that's really not really good. And now, the enforcement of tobacco control. We really couldn't find a clear mechanism of coordination between the various power actors at different levels of government and enforcement officers at the ground level. And this is, we mean like the school system or the religious leaders. There's also insufficient funds for human resources that actually are supposed to do this enforcement. And there's actually no mechanism for monitoring tobacco control interventions. Of course, the tobacco industry has a lot of interference with the implementation of this policy. And this is, of course, largely because, I mean, they give revenue. I mean, they create some revenue for the government. Now, the other part is there's no actually clear policy on what is actually interference by the tobacco industry, as we saw in those pictures before there, and therefore the industry is happy to do some subtle advertising, sponsorship, and that kind of thing. Now, the Ministry of Agriculture is actually supposed to suggest to farmers and actually encourage them that they use other crops like possibly pepper, possibly cashew nuts, other crops that they can actually export and generate income. But however, we find that that's still not happening. Now, tobacco quit strategies. Um, Health professionals still aren't really adequately trained to offer the advice, and there isn't actually guidelines or any policies about the quitting strategies. And of course, people who want to stop, let's say, smoking have to use their own private means, possibly buy some nicotine replacement therapies from the pharmacies, and there isn't really a quit line for smokers, and they actually have to use the one that's provided for by the government through the National Drug Control, which actually, I mean, involves many other drugs as well. Now, the illegal trade and smuggling of tobacco products, that still happens. The Kenya Revenue Authorities actually put in some measures, however, because I mean, because of porous borders, that still happens now and again. Now, it was also to prevent people under the age of 18 from buying tobacco. And however, you see that children actually go and go purchase these things, and no one actually asks them for identification. Of course, this makes it dangerous, especially in schools. Now, taxation and pricing. The Ministry of Finance was actually supposed to increase the price of tobacco, of course, sustainably, so that, I mean, they match those that's actually recommended by the World Health Organizations. Um, but that's really still not happening. Of course, the tobacco industry interferes with that. And so these are the recommendations, really. There needs to be better coordination, and of course, need to be assigned rules. Human resources, more funding, needs to be clear policy to inhibit tobacco interference, I mean, by tobacco industry. There needs to be better monitoring of the interventions as well. Now, the consequences of floating the rules, or rather the act, those ones have to be enforced, and increase taxation as well on the tobacco companies as well, to discourage people from purchasing, I mean, tobacco products. Now, there needs to be more pictorial warnings on the packagings as well. Now, we also need to eliminate smuggling and trade, of course, illicit trade in tobacco. The farmers need to be given alternative. They need to be supported in this, given alternative crops to farm, and so that they can export and generate income as well. Now, the contents of tobacco need to be standardized so that, I mean, it matches up, of course, with the global standards. Now, health professionals have to be trained as well, and so that they know what to do, I mean, for somebody who wants to smoke or to advise. And there needs to be more campaigns and public awareness. And also, the tobacco companies have to be banned from subtle forms of advertising, as we've seen in those photos before there. And that's actually, I would say that's about it.